Newborn screening is a blood test done for babies shortly after birth to look for serious, treatable diseases. The goal of newborn screening is to find babies with these diseases before they get sick. Every year, approximately 145,000 babies are born in Ontario. Most look healthy at birth, but approximately 400 will have diseases identified through newborn screening. If undiagnosed and untreated, these babies may develop serious health problems. A key step in newborn screening is obtaining a satisfactory newborn screening sample. This video highlights the steps necessary to collect a high-quality sample. Detailed information on sample collection can be found on Newborn Screening Ontario's website. Step 1. Parent education. Healthcare providers must educate patients about the value of newborn screening prior to sample collection. Give parents the parent information sheet from the newborn screening card. This information sheet contains important information about newborn screening and a unique identifier that is also on the newborn screening card where the blood sample is collected. In addition, give parents a copy of the Ministry of Health newborn screening pamphlet. English and French pamphlets can be ordered through Service Ontario and are available on the Newborn Screening Ontario and Service Ontario websites in 18 other languages. Step 2. Pain relief for baby. There are several ways to help babies cope with blood work. The most effective method for pain relief is breastfeeding during the procedure. If breastfeeding is not possible, kangaroo care, where the baby's held skin to skin against the parent's chest, or sugar water can also help reduce the baby's pain. Step 3. Sample collection supplies. The best time to collect the newborn screen is between 24 and 48 hours after birth. Newborn Screening Ontario recommends that a sample be taken for every baby prior to discharge from the hospital. If a sample is taken before 24 hours of age, that baby will need a repeat newborn screen. Before sample collection, gather all the materials that you'll need. The blood is collected on a special newborn screening card that has a filter paper with 5 circles on the top. Check the expiration date on the card before use. Try to avoid touching the filter paper portion of the card with your bare hands to prevent contamination. Fill the card out legibly using blue or black pen. Accurately completing the information on the newborn screening card is important so the baby's results can be properly interpreted. If you use a hospital stamp or sticker, ensure all copies of the card are stamped and stickered and that you write in any additional information required. If the parents decline newborn screening or choose to defer screening, please complete the Decline Defer form on the last page of the card or the Decline Defer form from the Newborn Screening Ontario website. Gather the rest of your supplies, including the newborn screening card with demographic information completed, gloves, alcohol swabs, a lancet with a maximum depth of 2 millimeters or less if the infant is premature, and sterile gauze. Step 4. Sample collection. Warm the baby's heel by bundling the baby or with an approved heel warming device. Check the demographic information on the newborn screening card and the baby's information to ensure positive identification. Wash your hands and put on gloves. The puncture site should be on the side of the heel. Other areas may damage the bone. Clean the site with an alcohol swab and allow it to air dry. Use the lancet to puncture the baby's heel. The first drop of blood should be wiped off with a sterile gauze. Do not aggressively squeeze or milk the foot, as this might cause hemolysis. Allow a large drop of blood to form, and then touch the blood to the filter paper. Apply only 1 drop of blood to each circle. There should be enough blood in 1 drop to fully soak through the filter paper. If the circle is not completely full or saturated, move on to the next circle and start with a larger drop of blood. Do not attempt to apply a new drop of blood over a drop already on the card. If blood falls outside the circles, it can be tested. Fill all 5 circles completely. Check the back of the card to ensure that the blood has soaked through. After the card is filled, care of the puncture site should be consistent with your institution's procedures. Allow the card to dry on a flat surface at room temperature between 18 to 22 degrees Celsius, away from heat and direct sunlight for at least 3 hours. Also be sure to not stack the cards on top of each other while they're drying. Step 5. Sending samples. Before mailing, close the protective flap over the blood dots. Send the card to Newborn Screening Ontario using the prepaid courier service as soon as possible. It's important to send samples to Newborn Screening Ontario every business day, as well as on Saturdays for sites with access to Saturday pickup. This ensures that affected babies are identified as soon as possible and that treatment can begin before babies develop serious health problems. Healthcare providers play a key role in the newborn screening program. Parent education, pain relief for the baby, gathering the correct supplies, proper sample collection technique, and promptly sending the samples to Newborn Screening Ontario helps ensure that every baby in Ontario gets the best start in life. In newborn screening, a healthy start leads to a healthier life.